Generally, people with Parkinson's experience difficulty in normally automized motor movement, resulting in frequent and debilitating falls, where 50 to 70% of patients experience falls, 18% sustain fractures, a fall rate that's 30% higher than that of older community-dwelling adults. In the on-phase of medication, improvements are seen, though speed of walking commonly remains about two-thirds of the normative range in majority of patients, concluding that timing-related disorders are not actually responsive to medication. Researchers investigated turns, an integral part of functional locomotion, given that we turn at least twice every 10 steps to perform common daily activities. These are potent sources of akinetic blocks that trigger freezing in almost half the population, and when comparing turns in young people, and elderly people with Parkinson's, researchers found slower velocity, reduced stride length, increased cadence, and increased stride width compared to controls. People with Parkinson's also required more steps per turn and had a greater difficulty with larger turns, where healthy adults tend to take fewer than 6 steps for a 360-degree turn, whereas those with motor instability took up to 20 steps, each smaller than the next, with limited movement of the head, arms, and trunk, unlike fluidly moving controls. Finally, if we consider community ambulation, one is required to walk quickly, easily, and turn frequently. These open environments divert attention away from the primary task of maintaining stable gait, and consistently show marked impairments, limiting the ability to ambulate and participate in meaningful work, social, or leisure activities. Though there is no cure for Parkinson's disease, various medicines, surgeries, and therapies can help people successfully manage their symptoms. They are encouraged to visit a neurologist to cater a holistic and individualized plan, as everyone's experience with Parkinson's disease is highly unique. Medicinal treatment for Parkinson's includes drugs like levodopa that replenish dwindling dopamine levels in the brain, or those that attenuate side effects, symptoms, and rate of progression. Current medical management is only partially effective as it mainly addresses symptoms associated with dopaminergic lesions. Neurosurgery entails a device in the chest that stimulates surgically implanted electrodes in the brain to stop movement-related symptoms. However, results are quite divergent. While some increase walking speed and reduce dyskinesia, others minimally affect hypokinesia, dystonia, and tremors. In terms of cues, the use of external cues, which are visual, auditory, or somatosensory stimuli, and attentional strategies, which are cognitive processes used to compensate for movement disorders, have been shown to improve gait immediately upon trials. They are thought to enable the premotor cortex and supplementary motor area to compensate for defective mechanisms of motor control in the basal ganglia, as seen by elevated blood flow activity in these areas using cues. A meta-analysis found visual cues in the off phase generated more normal stride length and gait velocity in individuals, decreased cadence, while strategies like mental rehearsal and planning have shown progressive short-term improvements and error reduction. The use of white lines on the floor and rhythmic beats throughout a metronome allowed older adults with moderate to severe Parkinson's to walk longer and at a more normal stepping rate, and hip extension, knee flexion, and ankle range of motion all increased, indicative of a high steppage gait to ensure clearing of cues. These studies confirmed the ability to move is not lost, and the problem